Welcome to another episode of the Hack My Age podcast. But this time we are doing a solo episode. This is a bonus episode, and we're not going to have any introductions, no call to action. We're just going to get straight into it. So I want to try to get through this as fast as I possibly can. So if you saw that newsletter release last Sunday, you saw that I announced my plans for going under the knife. That meant a hip surgery, a total hip surgery. A shock, horror. Zora, how can it be? She's the healthiest person on the planet. She must exercise too much. Hang on. These are the kind of questions that I get all the time. Like, how is it even possible? And I'm going to explain. So today I will cover a little background about myself. What is osteoarthritis? How did this happen to me? What I tried, what helped for relief and what didn't, what I would still try before surgery if I were you, and then the pre and post surgery hacks for a speedy recovery. So if you want just those hacks, just fast forward straight to the end. So who am I? I'm 54 years old right now, and I'm very athletic. I'm not a professional, never been. I'm a dancer at heart. I love dancing. I move every day. And I love to test the limits of my body. It's always been that way. Now, my favorite activities when I could move, at least from the recent past, is dancing, of course. It's always got to be in my life. Road biking, hiking. I love going to gym classes, doing HIIT and strength and yoga. Those are kind of what I'm into lately. But I'm the kind of person that will try anything. Somebody wants to say, go play golf, I'll go play golf. Somebody wants to do paddleboarding, I'll do paddleboarding. Skiing, I'll ski. I'll do whatever. I'll give anything a go. And I go through phases through life. Throughout my life, in the 80s, 90s, I was doing aerobics and racquetball, step. I was even an aerobic instructor at one time. And then I moved on, and later on in my life, I was doing paddle tennis and kickboxing and running and dragon boat when I was living in Hong Kong. That's like rowing. And I'm dreaming of maybe doing a triathlon one day, wakeboarding, snowboarding. I still want to do so much more. My diet, pretty healthy. I work best with a balance of protein, fats, and carbs. I'm never like keto or high carb or low carb. And just kind of what works for me is that balance. And I'm not perfect. I don't like diets. I eat quite a lot of food. People always surprised, like how small I am and how much food I can pack in. When I'm training, I just definitely do not fast. But now my body just demands less. Kind of a no-brainer. I'm doing about 3,000 steps now when I used to be easily 10, closer to 15,000 steps a day. It was just the way my life was. I was very active. I'm not a smoker. I'm not a drinker. I've got a healthy body weight. I have high muscle mass, and I've got low body fat. So that's just the profile of who I am, in case you're like that too, because that is not the profile of somebody who has osteoarthritis. When you Google this, the recommendation for osteoarthritis is lose weight. It's not me. So I had to go find some other way. So what is osteoarthritis? People think it's osteoporosis. No, osteoporosis is loss of bone density. My bones are dense, especially around my hip. I've got osteopenia in the spine, but I've got the bones on my hips are actually pretty good. And I'm in that green zone when you take that DEXA scan. Osteoarthritis is a degenerative joint disease, and it happens when that protective cartilage on your bone, anywhere that is, and it's supposed to act like a cushion, that wears down, okay, for one reason or another over time. And then what do we get? We get pain, stiffness, swelling. And for me, the worst is, this is the biggest pain in the butt, is the reduced joint mobility, no range of motion. And as long as I don't move, I have no pain. I'm good. Like, I can sleep like a baby. I've got no issues with that. It's the joint, when I get out of the range of motion, then it's painful. I just can't move, and that's not healthy. So when it comes to osteoarthritis, the knees are actually the most common type of osteoarthritis, and women are more likely than men to get hip osteoarthritis, especially, get this, after menopause. And that's when we get a faster progression of the disease compared to men. And that's me. 528 million people in the world are affected by osteoarthritis. And this is maybe they're getting surgeries, not surgeries, I don't know, but there's a lot of people dealing with this. That's 6.8% of the global population. And osteoarthritis is just one of those most common joint disorders. And the prevalence is increasing every year because of things like, well, obesity and sedentary life. And the population is aging. And my personal take on this is I think people are quite active now into their later life. So maybe we're pushing it. I don't know. But again, I'm going to tell you some of the risk factors later on. 400,000 surgeries are done every year in the US for hip osteoarthritis. So globally, it's in the millions, maybe hundreds of millions. It's quite a common thing, which I didn't realize when I first was diagnosed with this. I was like, isn't that supposed to happen in your 70s? Like, I don't know anybody in their 40s getting this when it was first recommended to me. What are the risk factors? Do you have any of these? Well, you certainly do have some. The risk factors are age, right? Well, age is the biggest risk factor for all diseases of aging. So we can't do anything about that. Now there's gender. Are you a woman? Well, more likely you are, so you're more at risk for this. Then there's your genes, all right? You have to consider, are you programmed for this? Are you more susceptible to it? Because we can change the behavior of our genes, that's epigenetics, but your genes, pretty much, other than, CRISPR or some gene editing, we're just kind of stuck with them. Obesity, that's what I keep reading online. Joint injury, if you injured yourself, which I did in the past. Congenital hip disorders, that's meaning you're born with, say, hip dysplasia, which I'll explain what that is later on, or femoroacetabular impingement, which is also known as FAI. If you got impingement, you know what that is, and that's a risk factor. Your occupation, so if you're lifting heavy things, depending on kind of work you do, that may put a lot of pressure on the joint, then that also is a risk factor. Sports, what does it mean? You don't exercise, but it's a risk factor. There's risks when you do sports, but there's risks when you sit on the couch and do nothing either. So it's finding that balance. Then there's bone deformities. Maybe you were born with some wonky bones. Nutritional deficiencies, especially low vitamin C and vitamin D, smoking, and then this is the last one, hormones, especially menopause. So this is really interesting. Out of all 12 of these risk factors, I got 9 of them. I don't have the obesity, the occupation, or the smoking part. That sets me up for something. So how did this happen to me? Each person I meet or each practitioner I meet has their own theory. And I don't even know if it really matters, but if you see a physio, oh, you walk poorly. If you see a posture person, oh, you've got poor posture, or your eyes are looking the wrong way, or jaw's too tight. A masseuse will say you've got too much stress. A nutritionist will say you're eating lectins. A healer will say you've got childhood trauma, intergenerational suffering that your great grandma had, 8 centuries ago. A geneticist will say it's your genes. And the surgeon is she's kind of, at least the one I've got and the ones I've been seeing is like, it doesn't matter. It's just, let's get you better. But I have been told by the surgeons when I ask, like, how is this even possible? I'm not even like a professional athlete. What's going on? And they tell me lately that it's likely due to hip dysplasia. And I was never really told that before. Didn't know that was. And what is hip dysplasia? That was my question. I was like, what is that? I've never heard of it. And this is another congenital condition where that hip socket doesn't really cover the ball portion of that femur, that upper thigh bone. It just slips around. It doesn't cover it completely. Imagine it kind of a little off. And this is more common in women, and probably due to the fact that we give birth, right? And our hips need to open up to let a baby out. And then there's the genetic factors that may predispose you to hip dysplasia. And that's a really, really, a significant role. And then there's the hormones, or a lack of, that's affecting the joints. And then if you do have hip dysplasia, you're just at an increased risk of early onset osteoarthritis, which is my case, because this is too early at 54 to have this problem. And then there's dancers, and they have more joint flexibility, and they may be fooled because that flexibility sometimes masks the symptom of mild hip dysplasia. Could have been me, don't know. And then there's the extreme flexibility, which again, that's me. I thought it was all cool to do all these fancy leg lifts and stretches. And I was like, wow, I'm so flexible, so proud of it. But that can lead to joint instability and then the potentially worsening effects of this hip dysplasia, if that's what it is. Again, in the end, I don't really care. I just want to get better. Now, if you want to know my history, I'm going to tell you a little bit, maybe, some of the things that happened to me, maybe it happened to you. Maybe it's going to give you a clue. If you have no interest, you just fast forward to the hacks. So about 10 years ago, I did a deadlift and I heard a snap. I was bedridden for a couple of weeks, went to the doctor, hip impingement. Oh, what's that? Oh, okay, whatever. I did a couple of weeks of physiotherapy, gone. And I was like, okay, whatever. I didn't even hardly look into it. I just wanted to get back to my activities. It could have been, in about 30 years ago, I had an ACL tear in my knee. I was skiing, fell down, tore the anterior cruciate ligament in my knee. And perhaps, again, another theory that I have, no one ever said, but is maybe 30 years of a little bit of compensation. Even though I could do everything that I wanted to for 30 years practically, maybe those micro movements, who knows? I don't know. Pretty much ignored everything until about 2020. Some doctors were saying surgery. I said, no way. I was far from it because I could still do so much. And then I found PRP injections, and that's platelet-rich plasma. So when it started to get bad, I'm like, okay, let me find something else to pull me through. And then the PRP is when they take blood out of your arm, usually, and they spin it in a centrifuge, and 15 minutes later, they re-inject it into a joint. And I did a lot of research on this, and I was like, okay, this looks something I could try. There was like I don't know, it was pretty range. It was maybe 50 to 80% success rate, pretty low. And I was pretty wide range, but I thought it's certainly better than surgery. Why not try it? So I did. And that brought really good relief. I had done my knee like ages ago, although I'm not using it so much anymore. And the knee is, fine. And the hips, they were really good for about a year and a half, more or less. And then I just re-inject again, get back to my normal levels and range of motion and all that. So I liked PRP. And then around 2022, bothering me again, I take more MRIs, I get spurs and cysts. And then I'm like, okay, PRP is too expensive a Band-Aid. I got to find something else. And I was attracted to a drug called peptide polysulfate. And this has been recommended by Boulder Longevity Institute, my favorite regenerative medicine doctor, Dr. Elizabeth Yorth, and her team there said, why don't you try that? And it's an injection. You inject yourself. And I did that. I spent a whole year with that experiment because the time I would receive the drug in my hands, because I was in Europe and the drugs were made in the US, it took a while. Then I do like a 3 or 4 month round. And then I did another round and I felt zero relief. I was really disappointed because it was really expensive and I wasted a lot of time when I thought, oh, maybe I could have done PRP, would have been better, but I didn't want to mix things. And this is pricey. So I still would recommend, if you are curious, go read up on peptide polysulfate. I would still recommend it as a form of treatment, depending on how your condition is. But the research that I was presented by Dr. York was amazing. So anti-inflammatory. It does so many good things. There's so many side benefits that there was no reason not to take it. And then I decided to get into, let's see, I got distracted by the phone. Hang on a second. So now fast forward to January 2024. That's earlier this year. And I was ready for hip surgery. I was like, okay, just cut my legs off. I can't stand it anymore. And the surgeons that I saw said, no, we don't recommend surgery. We recommend you hyaluronic acid injections. And I was so surprised because now the tables were reversed. I wanted the surgery and the doctors didn't want to give it to me. So then I said, okay, this is probably where I need to be. Let's do them. Hyaluronic acid, actually, that worked pretty well to bring some relief, but not enough. It lasted about a couple of months. And it didn't even get to the same levels as my PRP did. But to be fair, the PRP that I did, I know the doctor, he makes this cocktail with hyaluronic acid injected into it, as well as curcumin and, other anti-inflammatory stuff. So again, head-to-head PRP hyaluronic acid. I think if you were to try any of these, like, who knows what your results will be. That's why you just get your biohacker hat on and you just choose one and decide and see if that works for you. Certainly hyaluronic acid is much better than steroids and steroid injections. And hyaluronic acid, your body produces hyaluronic acid. It's nothing really foreign to the body. So it just gets reabsorbed and done. So then I was good. April, May, June, I did 3 series of PRP injections. And then what happened there was, okay, yeah, because I explained myself that hyaluronic acid injections didn't really work for at least not enough. So that's when I did more PRP on both hips, but it was too late because I didn't get any results. Maybe a tiny bump, I got a little bump. That was it. It got me through a lot of walking in June that I had to do for conferences and things, but went seriously downhill after that. So what have I tried? What else that you're thinking? Because there's so many things that you can do. I have spent tens of thousands of dollars on treatments that I've tried without much relief, but I'm going to tell you which ones kind of did, which didn't, and what maybe to try yourself if you want. And I don't want to poo-poo any of these. Just because it didn't work on me doesn't mean it doesn't work on other people. It's the reason I tried a lot of these things is because you hear someone goes, oh my God, it helped me so much, or it helped my dad, or it helped my son. You're desperate. You're really desperate. So any treatment that I try, this is just my personality. When I give something a go, I do 110%. I do exactly as prescribed. I follow so well. I create the environment. I manage my diet, my lifestyle is to a T to try to help whatever treatment that I'm doing go along. So I know it's just not that magic one bullet, but it's just things all together. So HRT was my hopeful thing. I started it when I was 50, but I started it on very baby doses because I didn't know better at the time. And I slowly, and it wasn't like all the HRT at once. You started off with just vaginal estriol, and then you added maybe a little bit of progesterone cream. And then I slowly, and then the next year I added something else. And the next year I had something else. And of course, these were all very small doses. So I kind of questioned myself, if I had a doctor that understood really well hormone therapy, would that person increase my dosages? Of course, monitor me and make sure I'm feeling good and nothing is going wrong. But I still big fan of HRT because I have recommended plenty of people who've had arthritic pain, let's say joint pain, and HRT solves the problem, or it takes off like at least 80%. It's amazing. And I was so hopeful that would be for me, but it wasn't. Then I tried platelet-rich growth factors. It's different than PRP because it has a lot more growth factors than PRP. Didn't work one bit. And I did two rounds. Maybe I should have done 3, but when you don't see any kind of progress after the first or second injection, you kind of get deflated. Physiotherapy, of course, and rehab exercises, these have never stopped in my life. I continue to do them. I don't know why, just they're boring mobility things. It's dwindled down, before you do some squats and then, some you felt, some things, but now it's just pretty much trying to get mobility but when those exercises, I do them, it's still quite painful. But I still would highly recommend you just find the right person. I think my problem was I travel a lot, so I could never continue with the same person. And even when I did find somebody, it didn't work. And I just stuck with them because I'm pretty loyal and I should have maybe moved on. The next I tried was block therapy. Try that, didn't do much. Red light therapy helped relief when I was feeling like, oh my gosh, I think I walked too much today. I'd use the flex beam. That's the one I use because I could put it directly on the joint, and I put it in all different areas. That brought some relief. It doesn't reverse anything. Ice bathing as well when it was really cold. It has to be really, really cold for me for some reason. I don't know. And then I felt a little bit more relief as well. It just feels like less inflammation, but I don't always have access to an ice bath. Again, how many times can you do that? Cryotherapy didn't work. Acupuncture, not really. Acupressure, nothing. Massage, I've done anything from soft to extremely painful massage. The only one that brought me some relief was the extremely painful one that I got in Vietnam. I swear I was crying. I think it was the most painful thing I've ever done in my life. But then I had like a 50% improvement, and it lasted 24 hours. It was like, oh my God. But I carried on because massage was pretty cheap in Vietnam, and I continued them as well in Thailand, and didn't do anything in the end. Myofascial release, that makes me feel a little bit better. Just a tiny bit of improvement. Magnetic therapy, nothing. Supplements, curcumin, collagen, chondroitin, glucosamine, all kinds of joint formulas, nothing. I don't feel any difference if I'm on them or off them. Pain reprocessing therapy. Pain reprocessing therapy is really interesting. That I felt it helped me a lot when you're in the worst of your pain, if you're really going through emotion, or, especially in the beginning when I was like, what is this? This is not just a little niggle anymore. And I was using this app called Curable, and it taught me how to, the thoughts in my head, and we have these pain pathways in our brain, and what it's trying to do is reprogram those pain pathways. But I think I have a really high threshold for pain, and I think many women do. And when you go through chronic pain, that threshold gets even higher. And it's just, how much can you reprocess? I couldn't get it enough, but it did help because if you are feeling a lot of pain, and you focus on that pain, and you're worried about it, and you're thinking about it, it's worse. But if you can deflect, and it's literally like having conversations with your body that it's safe and it's okay. It's kind of weirdo, but I have to say it did kind of help. So go check out that app called Curable. Emotional freedom therapy didn't work. Anti-inflammatory diets, I don't know, maybe, my diet is already pretty anti-inflammatory, but I went to the extreme, the whole Dr. Gundry thing. That kind of worked in the beginning, and then I eat lectins again, but definitely not as much as I used to. But I don't know. I don't know if I can give that much credit. Fasting, detoxes, sauna, sleep hygiene, meditation. I did lots of Joe Dispenza. I still do Joe Dispenza. I'm on a challenge now to do meditations every single day for 6 months, 4 months exactly down the road. That doesn't work. Breath work. I'm a breath work instructor. There's no one who knows more than I do, and it's not working. Mindfulness, yoga, rolling. Vibrating bowls kind of helps a little bit. They're really expensive. There's these big old balls, and they have 1, 2, 3 different settings, and it's low vibration, high vibration. That helped a little bit, bring some relief. So if you want some relief, I'd invest in that. Block therapy, cupping, gua sha, PMF mats, neuromuscular electrostimulation, blood flow restriction, Theragun, visualization, Indiba, shock therapy. Shall I go on? There's others that I haven't even mentioned here. And there's some that I didn't try that I heard brings relief. So maybe this is for you. I just ran out of time. Is the inversion table that was recommended by my biohacking bestie, Nathalie Niddam. She said it helped her husband a ton. I never got to it because, again, I'm travel, and it's just was always hard to get, but I would seriously try it if I could. Do you want me to repeat those things that helped? It was red light therapy, ice bath, massage, myofascial release, pain reprocessing therapy, anti-inflammatory diets, vibrating balls. Those brought a little relief, but again, this is only temporary. Does this sound like you? I don't know. So what I would still try is get that inversion table. Still, one thing I didn't try that I certainly would if I had more time and more money, but I ran out of those two. So that's why I need to get surgery. I would try exosomes. They're expensive, but they're not as expensive as stem cells. And I just did a great live Q&A with Dr. Jeffrey Gross, who is with recelebrate.com. I'm doing a free plug for him. I don't know why, but okay. He's the one, he told me, he was in our group yesterday, and we did a great podcast with him, actually. See if I can remember to put that in the show notes, because he explained a lot about stem cells. But last time with our live Q&A in our membership group, he talked about exosomes. And I said, well, why exosomes? Why would what's the difference? Why between stem cells and exosomes? And basically they do the same thing. The results are the same. It's just exosomes are a lot cheaper. That's just, what attracted me most. I'm sure there's a lot of differences, but check out exosomes. BPC 157, definitely would try. I'm trying to get a hold of that. I never really tried because it's never easy for me to get wherever I am, but I finally found a place where I can get it. And I think I'm going to try it. The only thing is I'm not sure if I should really experiment, after the surgery. I would love to get it like today and start practicing. I could still definitely recommend rehab exercise, Pentacin, and hormone therapy. Keep on that if you're looking for relief. So why did I choose surgery? Well, I ran out of money and ran out of time. I just don't have any more time and I'm fed up. Really, the quality of my life is zero. I'm in chronic pain and there's a lot of emotional and mental health impacts with this. So unless you've lived with chronic pain, you have no idea what it's like. It's a lot of mind stuff, like just, I don't want to say that word mind fuck, but it's a mind fuck. And you start getting really negative. You think, am I going to be like this for the rest of my life? And then it's not fun. You don't go outside. You can't do anything with your friends. You can't do anything with your family. You have to always take taxis everywhere. It's just, who wants that? Honestly. So it's not only the physical, but it's the emotional and the mental impacts that have eventually a toll as well on the body. But going through this, I've got a lot of empathy for older adults now and those who are living with chronic pain. I used to be a little cocky when I was talking about, oh, you're going to move and exercise, and older adults, it's just they're not moving and they just became sedentary. So come on, guys, get on with it. Sometimes you can't. So, that's why I still think you should still find solutions, but I have a lot more empathy for them. So maybe that's, I don't know, the universe telling me to get myself a little bit more grounded. And I did learn a lot. Honestly, if you have any questions about any of those treatments, I went through so many. I can now really say with experience what my opinions are, at least in each category. So if you are looking for surgery, you may want to go, well, how do I choose a surgeon? And I guess this can go for any surgery, but when I was looking for a surgeon, I first consulted with Dr. Elizabeth Yorth because I really trust her from Boulder Longevity. And I felt like if I need surgery, she's going to tell me I need surgery. And if I don't, then I don't. Because I was back then really on the fence if I should, because it wasn't that bad yet. So she helped me with a lot of things who I'm going to talk about from now on. So we look at a surgeon's experience and their specialization. So you're going to ask, do they specialize in hip surgery or knee or whatever it is that you're going to get, shoulders? And how many hip surgeries have they done in a year or in their lifetime or per month? So you want to make sure they just didn't get fresh out of school. Although maybe in some ways that could be good because, hey, they're getting the latest information as well, but they may not have the experience. So yeah, I'd seen many surgeons. One surgeon who I absolutely loved recommended I do hip resurfacing, which is basically preserving your bone instead of chopping it off, because that's what total hip replacement, they cut your bone and put a piece of metal in there. They just put a cap on the top of the femur. They preserve your own bone, which I love the idea, but I would have been the first female that he does it on with the ceramic to ceramic. And I was like, I just don't feel like being a guinea pig. And I know he's got a lot of experience in other men, but I had to decline that one. So then the next question you want to ask is the surgical approach if you're talking about hip surgeries. And I was recommended to go find a doctor who enters through the front, the anterior side, the front side, not the side, the front, not the side, and not the back. And in my hunt, I chose to do this in Spain only. And I said, I could not find, out of, I think probably 8 doctors I've seen, no one does it from the front. So I've had to accept to the side because I found my dream surgeon. He had all these other great qualities. I'm like, well, what am I going to do? So I decided I'm going to opt for the side. The differences are the way he explained it to me is if you go through the back, it has the most, it's the least common that's used because it has the highest risk for displacement. I guess if you're, while you're healing, it can come apart. The side is the second less risk, and then the front is the least risk for that. But he says after you've healed, if you can get through this period, because the healing takes longer if you're on the side rather than the front, because it's easier for the patient to enter through the front, but harder for the surgeon. And the side approach is easier for the doctor and the surgeon, but a little bit harder for the patient. But once you've reached that recovery, it's all equal in terms of displacement. That's what he told me. Again, do your own research. And then you may want to talk about the materials that are used. There's metal on polyethylene, there's ceramic, titanium, cobalt. In the end, I didn't really mind after I found what it was. And I know that mine is a metal with a ceramic, kind of this dual thing, and explained to me why this was good. And I didn't become so headstrong on one material or the other, because in the end, each material, it doesn't mean that plastic is bad or metal is bad. It just means that there's different, the way I understand it, there's different materials that are for different people. If you're young and active, if you're older and more sedentary, or whatever it is. Also probably have to consider what's available in the country that you're in. So I kind of put that one to the side and said, get me whatever, because I had found a really dream doctor, that the best that I think I could find in my area. And the last thing you really want to do is look at patient outcomes and their reviews. Go and research this person if you can. In the US, I'm not sure about Canada, you've got websites like healthgrades.com, vitals.com, ratemds.com. In Europe, I find zero of those websites. You have some like 2 reviews sometimes on some wimpy little websites. So I can't review. We can't see. And if it's a bummer for us in Europe, or at least maybe there's somebody listening now who will say, no, you're wrong. And they'll send me something. I would love to update the show notes if they did. I couldn't find anything, but I did find a patient of his who loved him so much. She actually did the second hip, which I'm probably likely going to have to do at one point down the road. And she just had rave reviews, and she spent probably an hour and a half talking to me and telling me her story. And her profile was just like mine, which I was so happy, because it was nice to meet somebody just like me. And she got her hip replacement at age 49 or 50. So anyways, that brought a lot of comfort to me. I know it's just one person, but this doctor has actually ticked off all the other boxes. And then the communication, of course, and the rapport that you have with a doctor, that bedside manner, at least for me, is really important. Now, if I had a doctor that checked up all the boxes, didn't have great bedside manner, but he, that's the one, and everybody loves him, and he's just got the best success rate, then I would just probably forego, like, okay, whatever. I think it's hard to get every single thing on that list. If you do, lucky you. If you're in Sydney, I have one who does, can just send me a message and I'll send you to that person. And of course, there's Paulina Poroskova's surgeon in New York City. She's a top model who just got double hip surgery, and he's evidently famous, but probably has a big waiting list, probably costs a fortune. So the other things that you may want to consider is just the quality of the surgical team and the facility that you're going to be doing at it. There was one facility I saw that was kind of sketchy. I was like, ooh, this is kind of a dead hospital. Like, where are the people? It kind of freaked me out a little bit. The surgeon's approach to post-operative care is important, and the rehab is important. So, as well as, are they going to do follow-up care? And then maybe the most important, because this is a big deciding factor for most people, is, does your insurance cover it? And that's a big one. We've got a couple more things. I'm going to get to the hacks now, but I want to talk to the person who's on the fence still about it, because I know how you may feel in terms of when you speak to somebody who's had a hip surgery or maybe other surgery, I don't know, but at least with the hips, I've spoken to dozens of people, and they all tell me, Zora, you got to do it right now. Like, don't wait another second. Life is so much better on the other side. If I knew the one thing I regret is not doing it earlier. But you have to be in the right mindset. I've heard those stories before, and I was like, I am not feeling it. I don't want to be bullied into a surgery. I have a feeling that if I did resistingly do a surgery, I don't know if it would come out so well. I really think the body's pretty intuitive and pretty, it sounds really woo, but I think you have to be in the right mindset. And I think surgeons can tell, because some surgeons I've seen, I think they knew I was just not into it, and they kind of stopped the conversation there. So be ready for it. And now that I'm ready for it, I cannot wait. I am so excited about a surgery. Never thought I'd be excited. And of course it's scary. Of course you have anxiety. Of course you're like, I don't know. But in the end, I don't care. It's like, you just get on with it because you want a life back. So what are the pre-operation hacks? And I went over with Dr. Yorth's team at Boulder Longevity. I was like, okay, prep me. What am I going to do? What am I going to do? So what they tell me to do and what you can do too to prep pre-operation is dial in your nutrition. I know you might be like, I don't feel like doing a diet now. And oh my God, I'm feeling bad. Do it. Do it. Your life depends on it. A whole food diet with minimally processed foods. I'm going to keep it that simple. Okay. You know what's good for you and you know what's not good for you, right? Now is not the time to live to eat. It's eat to live mentality. There'll be other times you can, live to eat, but this is not the time. So what I'm doing is increasing my protein intake to 3 grams of protein per kilogram of body weight. I'm normally around 2. So I'm 5'4", 161 centimeters tall. I weigh about 110 pounds. That's 50 kilograms. I've lost some weight because I can't move. And that means I'm getting 150 grams of protein a day. I normally do about 100, more or less. And if I'm training, I do a bit more, maybe 120. But now, not training, and it's really hard because you're going to eat when you're not really hungry. So remember, 150 grams of protein isn't the same as 150 grams of chicken. Don't go and start weighing a chicken breast. That's just one chicken breast, and that weighs about 175 grams, but it has about 45, 47 grams of protein. Okay, so chicken breast, let's call it 50 grams of protein in one big chicken breast. And then you'd have to eat 3, or, not you're going to eat 3 chicken breasts, but you eat a lot of other foods that have protein in it throughout the day. Get that protein in. Now, exercise. Unfortunately, I just haven't been able to do impact exercises for over 2 years. So my routine is now really limited to just mobility and rehab, barely at all. But if you're not immobilized like me, if you're doing a shoulder or something, like you can go walk. And I've been doing upper body, a little bit of upper body, some little YouTube videos and stuff when I can. But, go do some cardio, strength, mobility, whatever you can. What I think has really saved my muscle mass is katsu training. And if you've followed me more than a minute, you see me running around with these bands on my arms, or bands on my legs. And this is it's like a partial blood flow restriction. They're amazing. For the little amount of exercise that I do, my muscle mass is there. It's actually even better than before. Doesn't mean I'm stronger. Doesn't mean I can do anything I want, but the muscle mass is there. And you can go check out my Instagram. You can read all about it. You can Google it. Everything is there. I'll have a podcast episode on that. The link in the show notes with Stephen Muñatones on katsu training. And if you want to get these bands, 10% off katsu.com, use code Zora, or email me. If you're outside of the US, and I'll try to get you a discount. Supplementation. I'm still on with the supplements, but I'm not relying on the collagen and although I do drink bone broth and I'm getting my collagen that way, but all those glucosamine and chondroitin, I just give it up. The most important that was told to take were the essential amino acids. Okay. That I'm taking. It's so easy. It's like eating a steak in a powder. Okay. I can do that. And then creatine monohydrate, I'm taking those. And urolithin A. And I just did a great podcast on that. And you can go, it's going to come out. Sorry. Yeah, it's not going to come out until October 25th, 2024. We're here. So urolithin A, creatine, and essential amino acids, these are all great for muscle health. Okay. I want to preserve my muscle. I want to keep it healthy, and I want to recover quickly. What I stopped taking, which a lot of things, but I've stopped taking right now, just pre-surgery, a week before surgery, I stopped all the anti-inflammatories in terms of turmeric and blood thinning stuff. Like turmeric, I don't really need to take off. I could continue with that, but I don't want to be taking it right before my surgery. I'm going to take it a lot after. I want fish oils. I want to take away the fish oils because that's a blood thinning, and we want the blood to actually clot and recover, not blood clots, but we want the blood to be able to recover and heal. And the fatty 15 I take as well. I put that on the shelf as well. So those are a couple of things I put on the shelf, and I think I'm going to just pretty much go off of most things until after the surgery. post-surgery, post-operation hacks. Post-surgery, like the focus is on reducing inflammation, preserving the muscle mass, and then detoxing from the anesthesia and the medications that I'm going to be getting, probably a lot of painkillers. So I'll reintroduce the turmeric and the omegas. I'll increase protein, creatine, urolithin A, and essential amino acids. And then I have the Quicksilver Scientific Detox Kit. Have it right now. And I was just starting my detox from the mercury, but I've paused it because I want to detox from everything else. So I'll start that 2 weeks post-surgery. And I'll have a link to that, to the detox in the show notes to the episode that we did with Dr. Chris Shade to understand a little bit more what that's all about. Now, this has been really recommended by Dr. Urith and her team, and it's going to be really hard for me to find all of these. So I'm just going to do what I can. I hope to at least take some of them, but I don't think I take all of them. But ideally, you take all of them. All right. If you're in the US, you could probably get all of these things, and even Canada. I'm not sure about Asia and Europe. Europe, definitely not. So nandrolone decant. This is a compound. It's a steroid, basically, that's used in bodybuilding. It's got a really bad rap, but when you're using it in smaller controlled dosages, it can help post-surgery recovery because it preserves our lean mass, it supports the muscle recovery, and it even helps with bone density, right? So my dosage, don't go to your own doctor, figure out your own dosage, but my dosage was prescribed to me 25 milligrams twice a week for 12 weeks on, and then take 6 weeks off and then do another round. And I don't remember how many rounds, but the problem is I asked my doctor for this in Spain and he's like, you won't find it in Spain. So now I'm going to have to find someone who may be able to bring it to me. And I'm guessing, I think this is nandrolone is an injectable. The next two are also injectables. Thymosin beta-4 or TB4. This is a peptide, really common, nothing crazy or weird. You don't need a prescription for this. You do need it for nandrolone. I'm pretty sure you need it anywhere in the world because that's a drug. Thymosin beta-4 is a peptide, and that helps with repairing the tissues, with the bone healing, and with inflammation. And it can also protect your gut from all the medication side effects. My dosage, and go follow your own doctor for your own dosage, but my dosage was 500 micrograms a day for as long as needed. Okay, so I'm guessing several weeks because evidently people recovering from hip surgery in 3 to 4 weeks. The next one is BPC 157. This is another injectable peptide, and it helps again with the repair of the tissues, the bone healing and inflammation, similar to TB4. It's protecting also the gut from all these side effects. My dosage, again, is 500 micrograms per day for as long as needed. Okay, so these are pretty simple, and I can get them in Europe, and you can certainly get them in the US and North America. The easy one, and I have already, is NAC. That's N-acetylcysteine. And that reduces these oxidative stress. It boosts our immune system, and it can help with detoxification. I take it anyways because I'm on hormone therapy. So I like to have that. And I will be taking 1 to 2 grams orally. It's a capsule for 14 days. And then after that, I'm going to go to my normal dose, which is between 600 and 1200 milligrams a day. The next thing that's a little hard to find, I'm still searching for this. It's called cerebrolysin 4. Okay, and 4 with the Roman letters 1 IV. Oh, sorry, it's not 4. It is IV. Duh, because it's an IV. So cerebrolysin IV. It's an IV that you take. It's a neuropeptide. It's made from pig brains, proteins. I know it sounds gross, but hey, at least it's animal-based, right? And it helps with nerve healing and reduces inflammation. And I'm supposed to do a 5-day course of 20 milliliters a day. If I'm lucky to find it anywhere, I'm on the hunt. It's got to be done with a clinic. It's got to be done something. I can't just order this and do it myself. And the last thing that is super easy to get is GHKCU. This is a peptide, and it's a cream or a serum. And this helps with collagen production, and it helps with the wound healing. So it's going to be for my scar to try to reduce the scar so it's not so visible. And I have to apply this every day for 1 to 2 months. So that's it, guys. I've gone a long time. If you're based in North America, Boulder Longevity Institute or Nathalie Niddam can help you with any of these compounds and personalize your dosage. I'll have links to both of those people. The Boulder Longevity Institute you have Dr. Ewarth and her team. Anyone on her team can help guide you. Nathalie Niddam is my biohacking bestie. She can help guide you too, as well as help you get these at a good price, because she's the peptide queen and can help you as well, guide you in your dosaging. So, and if you're really confused and you need help and you're not in North America, just reply to reply to this email, reply to me, find me on hackmyage.com and my website, or send me an email. Everything is there on the website, and you can send me a message on social media and I'll connect you to somebody or tell you where you can get some of these things. So thank you so much for listening to me. I know it was quite long and drawn out, but if you are dealing with osteoarthritis or any kind of surgery or chronic pain, I hear you. I hear you. You're definitely not alone, and you don't have to be somebody who's not a picture of perfect health to have these issues, because other than that, honestly, everything is great with me. So have a wonderful day, a good night, good morning, wherever you're at, and I will see you next time.